My guest is a public health physician and a special advisor to the President on Health, Dr. Salma Ibrahim Anas. Many thanks for joining us on Health Options.
Thank you very much, and good day, Nigerians.
Okay. Now, to begin with, with Tinubu administration's emphasis on health and social welfare since 2023, it's clear the health sector importance is now acknowledged. What drove this change in policy focus?
So thank you very much. I would like to briefly take us to the background, and to God be the glory, celebrating 2 years of administration and leadership of His Excellency President Bola Ahmed Tinubu. And his vision for Nigerians started even before the election. So in the health sector, he had a vision, he had a priorities for Nigeria, which fortunately I was part of articulating the mandate and the campaign promises around 8 key areas. And then after the election, His Excellency, for the first time in the history of Nigeria, established the Presidential Advisory Committee Council, Presidential Advisory Council, which was led by the current Minister of Finance, Mr. Wale Adun, and also the Minister of Planning, Alhaji Atiku Badugudu. So under it, they were to focus on the key sectors of development, and among which is health, education, the economy, and also agriculture, women development, and those were the key areas, and then the financing. So I was opportune to work also as of that time as the chair of the subcommittee of the Presidential Advisory Policy formulation around that time, which we refined the mandate and campaign promises of President Bola Ahmed Tinubu around 8 key areas. So I will quickly mention the areas so that we know where we are coming from, and then we can now, 2 years as of today, we will be able to ascertain the progress that we have made within the health sector.
Okay.
One of the key pillars or the priority of President Bola Ahmed Tinubu is to ensure that the governance of the health sector becomes very effective, very transparent, efficient to deliver healthcare services for all Nigerians, irrespective of where they are. And then the second aspect of it was also focused on financing, increased budgetary allocation, looking beyond government to mobilize additional resources, for funding for the health sector. So those were the second pillar. And then the third was on human resources, for health, to fill in the gaps of human resources for health and to be more innovative, and then come up with a more strategic policies and direction in terms of motivation of human resources, increased production of human resources, as well as the quality of human resources that will work within the whole entire spectrum of the healthcare delivery. Then another aspect that we also worked on that was a priority, one of the 8 key priority areas, is on integrated health that will enable Nigerians to have access to quality healthcare services. And this is looking across the tertiary institutions, specialized care, which is federal medical centers, teaching hospitals, orthopedic hospitals, neuropsychiatric hospitals, and all specialized cares, including fistula hospitals. And then secondly, the secondary level of care, which is under the responsibility of the state subnational government, and then the primary health care. So the focus is to see that how do we ensure that all those services are linked together and support each other with capacity building, mentorship, to ensure that the adequate services are provided to all Nigerians with a view to achieve universal healthcare coverage. We also have other aspects like public health emergency response under the global health security. We also have partnership. We also have another area which focuses on local production, local manufacture of medical medicines, drugs, assembly of medical equipment in Nigeria, so that Nigeria will be self-reliant and self-sufficient. And lastly, about the partnership. So those were the 8 areas the president identified even before election and promised that he's going to take it forward. And fortunately, this is where we are today, 2 years later, to see what progress we have made in those key areas.